The Early Language Milestone Scale, or ELM Scale, is a norm-referenced, validated language screening instrument covering the entire age range from birth to 36 months. Percentile values for the expected age of emergence for each item are provided. The ELM scale does not yield a specific developmental diagnosis. Rather, the ELM scale is designed as a rapid, reliable screening test capable of detecting language-impaired children at the youngest possible age, so that these children may then be referred to the appropriate specialists for formal diagnostic evaluation. The ELM scale will be of value in a variety of settings where developmental assessment of infants is stressed, including physicians' offices, well baby clinics, and therapy programs for developmentally delayed children.
The ELM scale consists of 43 items divided into 3 subscales: auditory expressive, auditory receptive, and visual. The ELM scale is able to detect children with speech or language delay from many different causes, including hearing loss, developmental language disorder, global developmental delay, oromotor apraxia, dysarthria, and autism spectrum disorder. Language milestones that are often delayed in children with autism spectrum disorder include reciprocal vocalization, following verbal commands, participation in gesture games such as pat a cake or peekaboo, and index finger pointing.
The ELM scale has been standardized on a population of 191 children, drawn from the practices of several private pediatricians, as well as from a university hospital-based pediatric clinic. By interviewing parents and testing children, a smoothed curve was derived from each item, reflecting the percent of children who passed the item at successively higher ages. The 25, 50, 75, and 90% values were extracted from this curve and converted into horizontal bar graphs. The white or unshaded portion of each bar represents the 25 to 50% range. The lightly shaded portion of the bar corresponds to the 50 to 75% range, and the black portion of the bar represents the 75 to 90% range. It is not necessary to score all 41 items when administering the ELM scale. One usually needs to administer only those items which are at or slightly below the child's chronologic age in order to pass the scale as a whole. Begin by computing the child's age in years, months, and days. Then draw a vertical line down the page at the location corresponding to the child's chronologic age. In this schematic diagram, recall that items to the right of, but not intersected by the line, have been attained by fewer than 25% of children this subject's chronologic age. Items intersected in the white or unshaded portion of the bar have been attained by 25 to 50% of children. Items intersected in the lightly shaded portion of the bar have been attained by 50 to 75% of children. And items intersected in the black portion of the bar have been attained by 75 to 90% of children this subject's chronologic age. Finally, items falling completely to the left of the age line have already been attained by more than 90% of children this subject's age. Begin by administering those items intersected by the line through the lightly shaded or black portion of the bar. Recall that these are items which have already been attained by 50 to 90% of children the subject's age. Work to the left until 3 items in a row have been passed. This constitutes the child's basal level. The child must achieve a basal level in each division without failing any items which have already been attained by 90% or more of subjects his chronologic age in order to pass the ELM scale. Many language behaviors fall into naturally occurring sequences. These sequences have been designated as item clusters on the ELM scale. There are 6 such clusters: babbling, orienting to a bell, one-step commands, gesture games, single words, and the name and use of objects. Item clusters require the examiner to deviate slightly from the general order of item administration. If any item in a cluster would normally be given, then the examiner should score all items in that cluster from the highest to the lowest, even though the age line might not intersect the higher items or may intersect them only through the unshaded portion of the bar. If a particular language behavior in a given item cluster is found to be present, then the child is automatically given credit for all earlier items in that cluster. This technique shortens administration time considerably by telescoping questions on multiple items into one another. Finally, note that each item is preceded by one or more of the letters H, T, and O. These refer to the allowable means of elicitation for that item. H stands for parental history, T stands for testing, and O stands for incidental observation of the behavior in question. Since the ages of emergence, as reflected in the bar graphs, are dependent upon the means by which these items were documented at the time of initial standardization, it is essential that the examiner adhere only to the allowable means of elicitation for each item when giving the ELM scale. Most items on the ELM scale are marked HO, since phenomena such as cooing and babbling cannot be directly tested, but must be ascertained primarily on the basis of parental history or incidental observation. Conversely, some items, such as orienting to a bell, are only to be obtained by testing. Always start by history where allowed. If an item is not passed by history, then proceed with direct testing if allowed. An item may be passed by incidental observation anytime where allowed. We will now demonstrate the administration of the ELM scale with 6 normal subjects at steadily ascending ages. Subject 1, chronologic age, 4 months, 4 days. Note that the minimum number of items required to achieve a basal level at this age include, in the auditory expressive division, items AE4, raspberry, AE3, laugh, and AE2, reciprocal vocalization. In the auditory receptive division, items AR4 orients laterally to the bell, AR3 recognizes sounds, and AR2 orients laterally to voice. And in the visual division, items V6, blink to threat, V5, visual tracking, and V4 responds to facial expressions.
Does she ever make sounds like the raspberry or blowing bubbles, like
Yes,
that?
yes.
She does.
She's just began to blow bubbles.
Very good. Does she laugh?
Yes.
She does. And can you have a conversation with your baby? By that I mean, can you talk to your baby and does she watch your face and lips, and then when you're quiet, does she vocalize back to you?
Yes.
She does
Yes,
that.
she does.
Very good. Do you think that she recognizes any particular sounds, like your voice or any other sounds?
Yes, I believe she does.
Mm-hmm. And if you come up behind her and start talking, what does she do?
She will turn her head to find where
She will.
the voice is coming from.
Mm-hmm. And how well do you think she hears?
I think she hears fine.
Think she hears fine. Okay.
Hello? Hello?
Okay. So she follows with her eyes. Hi. Yeah. Now, if you make faces to her, does she respond to your facial expressions?
Yes,
She
she'll
does.
laugh and giggle.
Very good.
In reviewing Subject 1's performance, we see that she passed items AE4, AE3, and AE2, establishing a basal level in the auditory expressive division. In the auditory receptive division, this child have failed to turn to the bell, AR4. Since this is an item which has not yet been achieved by more than 90% of children her age, she is not penalized for failing this item. The examiner was required, however, to administer an additional item in this division, AR1, in order to establish a basal level which consisted of items AR3, AR2, and AR1. Finally, in the visual division, this child passed V6, blink to threat, V5, visual tracking, and V4, responds to facial expressions. Since she has achieved a basal level in all three divisions, she has passed the ELM Scale screen. Subject 2, chronologic age, 7 months, 26 days. In the auditory expressive division, this subject's age line intersects items AE7, nonspecific use of mama or dada, AE6, polysyllabic babbling, and AE5, monosyllabic babbling, all in the lightly shaded portion of the bar. These are the three items which would be routinely administered to establish a basal level. Recall, however, that these three items, along with item AE8, correct use of mama or dada, constitute item cluster 1. For testing purposes, this means two things. First, we will ask the parent whether her child uses mama or dada correctly, even though the age line intersects this item only through the unshaded portion of the bar. Second, if a particular language item in this cluster is found to be present, then the child will automatically be given credit for all earlier items in the cluster, without administering each of these items individually. In the auditory receptive division, we would expect to administer items AR6, inhibits to the command no, AR5, orients over and down to the bell, and AR4, orients laterally to the bell. Items AR5 and AR4 are both part of item cluster 2 and will be administered and scored simultaneously. In the visual division, we administer items V8, follows one-step commands with gesture, V7, imitates gesture games, and V6, blink to threat. Because we will be asking about imitation of gesture games, item V7, we will also ask about the higher item in this cluster, initiation of gesture games, item V9. In a similar fashion, because we will be asking about execution of one-step commands with a gesture, item V8, we will also ask about execution of one-step commands unaccompanied by a gesture, item AR8.
Tell me, does Suzanne ever say mama or dada?
Occasionally.
And does she use those always to refer to the appropriate parent, or does she sometimes make them just as sounds?
She just makes them as sounds.
Just as sounds.
Right.
Okay, very good. Does Suzanne understand the command no? Does she stop momentarily when you say the word no?
No, not at all.
Not at all. Do you think she recognizes your voice or any other sounds?
Yes, I'm sure she recognizes mine and my husband's.
Okay. Very good. Now, will Suzanne follow any commands like come here or give it to me?
Usually if you say up, she'll start to hold her hands up now, but that's the only thing that she does.
Does she do that pretty consistently?
Yes, she does.
And do you have to go up like this?
Right, with my hands out.
If you went up like this, would she do anything?
I would probably say no.
Probably no. But if you put your hands up like that, she'll
Then she'll
respond on a
respond.
regular basis.
Right.
Okay. Does she play any gesture games like pat a cake or peekaboo?
We have just started a little bit with patty cake, and nothing with peekaboo yet.
And does she ever start those games up herself, or does she mainly
No.
copy you back?
She just copies.
Copies you back. Okay, very good. Now, let's see here. Hi, how are you? You're cute. There we go. Look at me. Very good. You want that, don't you? But I have to keep it. Okay. Now, let's see. Look at me. Hi. Okay. Okay. Very good.
Based on the mother's report, we give this subject credit for the nonspecific use of mama or dada, item AE7. She is therefore automatically credited with items AE6 and AE5, which are lower items in the item cluster 1. In the auditory receptive area, we note that this child's response to the bell was to orient directly downward on the diagonal. She is therefore given credit for the lower items in this cluster, items AR5 and AR4. Because she was not reported as passing AR8, one-step commands when accompanied by a gesture, nor to inhibit to the command no, item AR6, it became necessary to administer item AR3, recognized as sounds, before a basal level was attained. She is not penalized for having failed items AR8 or AR6, however, since these are items which have not yet been attained by 90% or more of children her age. In the visual division, she is not penalized for not initiating gesture games, since this item has not yet been attained by more than 90% of children her age. She readily achieves a basal level in this division by passing items V8, one-step commands accompanied by a gesture, V7, imitation of gestures, and V6, blink to threat. Subject 3, chronologic age, 12 months, 26 days. At this age, the minimal number of items to achieve a basal level in the auditory expressive division include item AE9, first word other than mama or dada, and AE8, the correct use of mama or dada. If item AE8 is passed, then the child will be automatically given credit for item AE7, since these items form part of item cluster 1. In the auditory receptive division, we would expect to administer at a minimum AR8, one-step commands unaccompanied by a gesture, AR7, orienting diagonally to a bell, and AR6, inhibiting to the command no. Finally, in the visual division, we would expect to administer items V10, pointing to desired objects, V9, initiating gesture games, and V8, one-step commands accompanied by a gesture.
Does your child spontaneously, consistently, and correctly have any words?
He has a word for hot when he goes near the oven.
Mm-hmm.
I'd say that's the only one.
Mm-hmm. And does he use that spontaneously, not just echoing you back?
Spontaneously.
Mm-hmm. And consistently, correctly?
Yes, yes.
Okay, very good. Does Paul say mama or dada?
Says dada.
Uh-huh.
He used to say mama, but he hasn't for quite a while.
Don't feel hurt. Most kids say dada before they say mama, it turns out. Now, when he says dada, does he use the word dada spontaneously, consistently, and correctly always just to refer to his father, or does he use that sound at other times as well?
He uses it at other times as well.
Okay, so he uses it correctly sometimes, but non-specifically at other times.
That's right. That's right.
Now, will Paul follow any commands for you, like come here or give it to me?
Yes.
Mm-hmm.
Yes.
Now, do you have to go come here, or could
Yes.
you go come here like this?
I have to coax him.
You'd have to coax him. And if you wanted to have him give you something, could you go give it to me, or would you have to go give it to me?
Give it to me with the hand.
You have to put your hand out. But
Yes.
he would follow you reliably that way?
Yes.
Mm-hmm. Okay, good. Does Paul understand the word no, even though he might not necessarily obey? Does he at least inhibit what he's doing for a
Yes.
few seconds?
Yes.
He does. Okay. Now, if Paul is sitting at the table in his high chair and there's something on the table out of reach that he wants, how does he let you know what he wants?
He makes noises and he points.
He will point, not just reaching with his whole hand, but actually,
He actually
index
points.
finger pointing.
Yes.
Very
Yes.
good. Does Paul ever play games like pat-a-cake or peekaboo with you?
Plays peekaboo. He's not so good at pat-a-cake.
And with peekaboo, does he copy you back, or does he ever start that up himself?
He initiates it.
He will.
Yes.
Okay. Now, let's see. Hey, buddy. Hi. Very good. You saw that, didn't you? Not talking, huh?
For this subject, credit was given for item AE9, first word. No credit was given for AE8, correct use of mama or dada. This was not held against the child, however, since fewer than 90% of children are correctly using mama or dada at this age. It did become necessary, however, to drop back and administer item AE7, non-specific use of mama or dada. With the passing of this item, and consequently all lower items in this cluster, the child successfully achieved a basal level in this division. Moving to the auditory receptive division, we see that one-step commands unaccompanied by a gesture, item AR8, was failed. The child did orient on a diagonal to the bell and inhibited to the command no. He was automatically given credit for orienting over and down to the bell and orienting laterally. These are part of item cluster 2, pertaining to orienting to the bell. He thus achieves a basal in this division. Finally, in the visual division, he successfully passed the first 3 items given. Since all 3 divisions of the ELM scale were passed, the screening itself is also passed. Subject 4, chronologic age, 18 months, 26 days. We will begin by administering items AE11, tells 2 wants, AE10, 4 to 6 single words, and AE9, first word other than mama or dada. Since items AE10 and AE9 constitute part of item cluster 5, we will also ask item AE13, 50 plus single words, since this item is also included in this cluster. In the auditory receptive division, we will begin with items AR10, 2-step commands, AR9, pointing to one or more body parts on command, and AR8, 1-step commands unaccompanied by a gesture. In the visual division, we will administer the 3 highest items, namely V10, pointing to desired objects, V9, initiating gesture games, and V8, 1-step commands accompanied by a gesture.
So he is just a little bit shy of being 19 months old. Right. Okay.
TV.
Very good. TV, that's right. TV. Well, that answers one of my questions. Let me ask you, how many words does Matthew have?
Several. I haven't counted them. Sit down.
Can you give me some examples of what he says?
Ball, cracker, shoe, clothes, car, horse, cow.
Okay. So he has at least half a dozen
still.
single words,
Sit still.
right? Now, does he use those words spontaneously, consistently, and correctly to label the appropriate objects?
Yes.
Okay. He doesn't just echo you back, but he'll say those
No.
words spontaneously.
Yes.
Okay, very good.
Timmy.
And does he ever use words to tell you what he wants?
Yes.
Can you give me some examples?
He'll ask for juice, please. If you offer him a cracker or a toy that he doesn't want, he'll say no.
Besides
he'll ask
asking
for
for
toy.
juice, what else does he ask for?
Bath.
What exactly will he say?
He'll go to the bathroom door and just say bath.
He'll say bath. He'll go to the
Yes.
bathroom door and say bath, really meaning I want a bath. But he'll just use the single word.
Yes, just say dildo.
Does he follow commands for you?
Simple commands, yes.
Now, let's suppose he's sitting in his high chair at the table. And Does he now, or when he was younger, did he play games like Pat-a-Cake or Peekaboo?
Yes.
And would he just copy you back, or would he sometimes start those games up himself?
He would clap for patty cake, but most of the time I would initiate it.
Would he ever start them up himself?
He would sit and clap. Yes.
He would. He would initiate that.
That much.
Okay.
Sit still. Okay.
Very good. You know, you're quiet all of a sudden, aren't you? Okay.
Up.
Up. Okay. I think we're done.
Okay.
And I think Matthew did very well.
Yes,
Let me
that's
just
Kimmy.
double check here. All right. Timmy.
Timmy.
Very good. We're done. Thank you very much.
This child pointed to a television monitor and spontaneously said TV. He therefore passes items AE9, first word, and V10, points to desired objects, on the basis of incidental observation. This child readily passed the first 3 items given in each division, and therefore passed the ELM screen as a whole. Subject 5. Chronologic age, 21 months, 26 days. We begin by administering items AE13, 50-plus single words, AE12, 2-word sentences, and AE11, tells 2 wants. In the auditory receptive division, we administer items AR11, points to named objects, AR10, 2-step commands, and AR9, points to 1 or more body parts. Because item AR11 lies within item cluster 6, name and use of objects, we will also attempt to administer the higher 2 items in this cluster, namely items AE18, gives the name and use of objects, and AR12, points to objects described by use. It is important to begin with the most difficult item in this cluster first, since the correct responses to each item are embedded in the questions for the lower items. For demonstration purposes, we shall administer all objects in items AE18, name and use of objects, AR12 points to objects described by use, and AR11 points to named objects. In actual practice, however, the examiner may discontinue these items after 2 out of 3 or 2 out of 4 components for each item have been successfully completed. Finally, in the visual division, we will administer items V10, points to desired objects, V9 initiates gesture games, and V8 follows 1-step commands unaccompanied by a gesture.
How many words does Andrea have? Roughly? Half a dozen, 10 or 20, 50, more than 50?
More than 50.
More than 50.
Greater than 50.
And does she use those?
What, honey? That's a doctor.
Doctor.
Yes, he's a doctor.
Doctor.
Yes, there's a doctor out there, too, that you met.
And does Andrea ever put words together into spontaneous, novel 2-word combinations?
Yes.
Not just phrases that she's memorized beforehand?
No.
Right.
Her own combinations.
Okay. Does she use words to let you know what she wants?
Yes.
Can you give me some examples?
If she wants to eat, she tells me that she's hungry. If she wants to drink, if she's messed her pants or if she has to go to the potty.
So she'll use words to
If
tell
she
you
wants
that.
to do something, if she,
Okay, fine. Now, let's see a few
she doesn't
things
like to
here.
sleep as much, so she won't tell me when she has to sleep.
Andrea, what's this?
Cup.
A cup. What's it for?
Mommy.
What do you do with it? What do you do with a cup?
Juicy.
Juicy. Uh-huh.
Apple.
What is it?
Apple.
An apple. Uh-huh. You see, some kids have bitten on that. They really think it's an apple. Okay. What's this? Spoon. Mm-hmm. What do you do with it?
Eggy toes.
She eats her eggy.
What did she say?
Eggy and toast. She
Eggy and
eats her
toast.
eggies.
What do you do with a spoon?
Eggy toast.
Eggy toast. Okay. What's this?
Cover.
What is it?
Pen.
Crayon. What do you do with a crayon?
Color.
Color. Uh-huh. Okay.
Color book.
Now,
Oh, that's not a coloring book, honey.
let's see here. Andrea, hold it closer a little bit. Andrea, give me the one we drink with. Where's the one we drink with?
Juicy.
Yeah, which one of these do we drink with?
Honey.
What do you drink with, honey?
Ask her to, let's see here. Andrea, give Mommy the one we drink with.
Andy, can I ask her? Do you want me to ask
Go
her?
ahead.
Andy, give me what you want to drink with. What do you take a drink with? Hmm? What do you take a drink with?
Okay, let's try another one. Andy, give me the one we write with. Where's the one we write with?
Hmm? Hmm?
Andy?
Apple.
Apple. Where's the one we eat with?
Apple.
Apple. Okay. Andy. Andy, give me the ball. Give me the ball. Atta girl. Andy, give me the cup. Atta girl. Andy, give me the spoon. That's my girl. Thank you very much. Will Andy follow any novel two-step commands for you, like go get your shoes, then go sit down over there? Mm-hmm. When she was younger, or perhaps even now, did you ever play the game with her, where's your eyes, where's your ears, show me your nose? And will she point to some of those before you point?
Oh, yeah.
Uh-huh.
You mean if I ask her and I
Right.
point?
Well, what I'm getting at is, instead of saying, where's your nose,
Oh,
and you
yes.
point, if you
Oh,
simply
yeah,
say,
yeah, yeah.
where's your nose, will she
I
point?
misunderstood you. Yeah.
She will. Okay, very good.
This child readily passed items AE 13, 50 plus single words, AE 12, two-word sentences, and AE 11 tells two wants. With regard to item cluster 6, juice is not a correct response for the use of a cup, nor is egg and toast a correct response for the use of a spoon. The fact that she failed item AE 18 gives the name and use of objects is not held against her, however, since fewer than 90% of children at her age are capable of this task. The same reasoning applies to her failure on item AR 12, points to objects described by use. She did successfully pass item AR 11, points to named objects, as well as items AR 10, two-step commands, and AR 9, pointing to one or more body parts. She also readily passed the highest three items in the visual section, and therefore passes the ELM screen. Subject 6, chronologic age, 2 years, 6 months, 23 days. We will start by administering items AE 18, AE 17, and AE 16 in the auditory expressive division, and items AR 13, AR 12, and AR 11 in the auditory receptive division. For children over 24 months who successfully passed the auditory expressive and auditory receptive divisions, we may omit the visual division altogether.
Me.
What's that?
Ball.
What do you do with it? What's it for?
Baseball.
Hmm?
Baseball.
A baseball. What do you do with a ball?
Catch it.
You catch it. Uh-huh. What's this?
A spoon.
A spoon. What do you do with it?
Yeah.
What's it for?
For oat.
Oatmeal.
Oatmeal. What's this?
A flame.
A crayon. What do you do with a crayon?
Color.
You color. Uh-huh. What's this?
Cup.
What's a cup for?
Rod.
What do you do with a cup?
What? What do you do with a cup?
Wait.
Drink it. Yeah, drink.
Okay. Now, does Daniel carry on little conversations?
Oh, yes.
If you would come home after leaving him with a sitter for a few hours and you would ask him, what have you been doing since Mommy's been away, would he be able to put 2 or 3 sentences together and tell you?
More than 2 or 3.
More than 2 or 3. Okay. Very good.
Well, that's a camera.
Yeah, that's a camera.
Uh-huh.
Right.
Does Daniel ever use prepositions in his own speech, like on top, underneath, things
Yes.
like that? He does, okay. Now, let's see here. Daniel. Uh-huh. Can I have those a minute? Put the block underneath the cup. Put it under the cup. Atta boy. Put the block on top of the cup. Good boy. Okay. Put the block behind the cup. Okay. Put it behind the cup. That's a boy. Thank you. Can I have it? Can I have it? Thank you.
This child successfully passed all items administered and therefore passes the ELM Scale screen. The Early Language Milestone Scale was introduced into clinical practice in 1983. Since that time, the ELM Scale has been used successfully in a variety of settings, including well-child clinics, neonatal intensive care follow-up programs, public health department screening programs, and doctors' offices. In response to requests from ELM Scale users, one significant addition and several minor revisions have been introduced. The biggest change has been the addition of a new item cluster pertaining to intelligibility of speech. The auditory expressive division of the ELM Scale now consists of 2 parts: content and intelligibility. This intelligibility cluster has been added in response to requests from users of the ELM Scale because many children seen for evaluation of delayed speech have unclear or unintelligible speech. The intelligibility cluster contains 3 bars: AE15 about half, AE19 3/4, and AE20 all or almost all. All 3 items in the cluster are scored by asking the parent the following forced choice question: how clear is your child's speech? That is, how much of your child's speech can a stranger understand? Less than half, about half, 3/4, or all or almost all. Parents or other adults in close contact with a child often become attuned to the child's speech pattern, including any distortions of speech sound production. Parents, therefore, are not the best ones to judge the intelligibility of their own child's speech. This is why the parent is asked to guess how clear the child sounds to others. How much of your child's speech can a stranger understand? This wording must be followed when eliciting the parent's response. If parents report that less than half of the child's speech can be understood by strangers, then the child fails all 3 items in the intelligibility cluster. If about half of the child's speech can be understood by strangers, then the child passes AE15 but fails AE19 and AE20. If 3/4 of the child's speech can be understood by strangers, then the child passes both AE19 and AE15 but fails AE20. If all or almost all of the child's speech can be understood by strangers, then the child passes all 3 items in the intelligibility cluster. If the child fails to attain intelligibility at a level equal to that, which has already been attained by 90% or more of the children his or her age, then the child fails the intelligibility cluster and therefore fails the ELM scale as a whole. The intelligibility cluster should be administered to all children 18 months of age or older. It should be administered in addition to the 3 or more items required to obtain a basal level in the content portion of the auditory expressive division. A child over the age of 18 months must pass both the intelligibility cluster and the content portion of the auditory expressive division in order to pass the auditory expressive division as a whole.
In 1993, a second scoring system was added to the ELM scale to permit the determination of a child's language level. This point scoring system is intended to be used in high-risk settings where language delay is already a concern, or in children who have failed the pass-fail screen. The original pass-fail method requires a child to pass the 3 items in each division of the ELM scale that are to the left of the age line. The point scoring system also requires the examiner to work to the right until 3 consecutive items in each division have been failed. This permits the determination of a point score and age equivalent for each division of the ELM scale and for the ELM scale as a whole. Further details of the point scoring method may be found in the examiner's manual. This concludes our presentation of the Early Language Milestone Scale. Purchasing information may be found at www.proedinc.com or Dr. Copeland's homepage, www.drcopeland.com.